Wellness for Life is brought to you by Perham Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership, CHI St. Joseph's Health Weight Management Center, and Natural Alternatives.
Welcome. My name is Ernest Hutta. I'm the owner and director of Natural Alternatives here in Monaga, Minnesota. And we have clinic sites distributed throughout the entire region. We affect the Fargo-Moorhead area. We also have clinic sites in Alexandria and also down in the Twin Cities in Excelsior, Minnesota. Dr. Mark Wheaton and myself clinic together. He's a sports medicine physician and a prolotherapist, and we've worked together for 20 plus years. Here in Monaga, we also have Dr. Dave Anders, who's a chiropractor, Dr. Dave Gottenberger, who is also a chiropractor. And what Natural Alternatives really truly is, and we talk about it in depth in the entire concept and the vision of this clinic, and that is the synergy of multiple practitioners working together, all of us focused on one thing, and that is your healing and your rejuvenation. Today, we're going to address an issue that we see in our clinic literally every single day. There is not a day that doesn't go by that we don't have people coming in and complaining of headaches and migraines. And headaches and migraines are not the same thing. And in fact, it's very interesting, as this morning as I was doing some research for the presentation, Mayo's got an incredible amount of research on migraines and headaches that people can go to their websites. You can go all over and find information about migraines and headaches. But the one thing that is missing from so many of these is a functional part of my training and background, and especially associated with a mentor of mine by the name of Dr. Bill Faber. And Dr. Bill Faber owned the Milwaukee Pain Clinic in Milwaukee, Wisconsin, and he talked about the fact that structure determines function. So in other words, if you have poor structure, you're going to have poor function. If you've got good structure, you're going to have good function. And so what does that mean in real terms? Well, if I take away your ligaments and I take away your muscles, your bones will fall to a heap on the floor. They're the only two things that are holding us together is ligaments and muscles. Muscles give us movement, and ligaments hold bone connected to bone. So every single joint in the human body, wrist, elbow, shoulders, hips, are held together by ligament structure, which is the underlying support component of our bodies. Muscles create stabilization and movement also, but the primary function of muscles to move our bodies. There's 600 plus different muscles throughout the entire body, and ligaments underneath all of that to support. So our goal here today is to show and help you understand. Go on and do the research and find out, but we are going to approach the idea of addressing migraines and headaches through affecting structure, because ultimately that's where it comes from. And that structural issue could be everything from whiplashes, car accidents that have happened, women who suffer with dysmenorrhea or hormonal issues, pelvic dysfunction. You cannot believe the number and the issues that we face in our clinic that are all structurally related and creating these symptoms. And one of the things that we see that is a very, very powerful component of structural dysfunction involving ligaments is a syndrome that is called Braille-U syndrome. You can also research that on the web, and it's spelled BARRE-LAIOU syndrome. And that syndrome talks about ligament instability in the cervical structure that can cause headaches and migraines. So again, our goal is to help you understand. I'm going to functionally show a little bit of time with a patient here to help you realize just one little breadth of how we might affect treating people for migraines and headaches. So a practical application of treating people with migraines and headaches in our clinic consists of integrating our therapy in the entire spinal structure. So I'm going to be using an electroacuoscope. This is a tool that we specialize in our clinic that is a microcurrent therapy device. And microcurrent therapy is very, very powerful in that it's very passive, easy to receive. It doesn't produce lots of contraction in muscle structure. Like if you go to perhaps a physical therapist or chiropractor, a lot of times they'll put a set of pads on you and you can actually feel the contraction or isotonic contraction of the tissue because of the device that they're using. We don't have any of that here. And so the electroacuoscope powerfully treats the entire spinal structure from top to bottom. You can see I've got a set of pads placed down here on her lower back, and I'm going to start beginning by going in and actually using a Y probe to treat her neck and release all the muscle structure in the upper thoracic and her cervical spine. Well, why is that important? If you remember earlier, I indicated that one of the root issues that we see in headache and migraine complex is that the low back is as big a part of the pain and dysfunction that a person is suffering with, sometimes even more so than the neck. And a lot of practices focus their time and energy on the cervical spine. as being the root source of migraines, or TMJ area, when in fact we find that the low back is as big a part of that. So I'm going to integrate the entire area of the spine together to get this effect of treating the entire spinal cord. And why is this important? Well, every human has what is called cerebrospinal fluid, which comes all the way from the brain structure clear down to the sacral stem. So it's moving back and forth, top to bottom, constantly flowing and moving on an entire spinal cord. So if something is fixated or damaged or irritated here, it's going to affect the flow of cerebrospinal fluid, top to bottom. And many, many, many people battle with injury issues that have happened to their low back that are ultimately contributing to their migraine or headache complex. So our goal, again, is going in right now, as I'm doing with microcurrent therapy, the electricity is tied to her low back. If we go over here and look at the machine, I've got the positive pole of this set of leads tied up to her low back, and I'm doing the negative set of this pole to the probe that I'm actually working in her neck, which is forcing the current to go from top to bottom. And the key here is to understand electricity always finds the path of least resistance. And by setting up the negative pole and the positive pole of electricity at different ends, I'm forcing that current to literally follow wherever I'm moving with this probe. As I'm moving, the current is moving with it. And so it really creates a profound way to treat and affect structure. Now, in another session, I'll get into talking about how we address the mid-thoracic spine and the low back with an actual application of the same nature. But again, today's lesson is addressing the issue of migraine and headache complex. Thank you again for spending time to learn about how we might address headaches and migraines. And obviously, every person's issue is different. Please come into our clinic, get an opportunity to experience and understand the natural alternative way of addressing these very, very common disorders that people suffer with. You can find us on the web at naturalalternatives.com. And don't forget, that's natural with the E at the end of it. So naturalalternatives.com, or you can call our clinic at 218-564-4200 here in Monaga. And welcome. We'd love to have an opportunity to help you with your pain and get you back on a road of healing. Thank you.
Coming up on Wellness for Life.
Hello, we're coming to you today from Mahabi Community Action Agency, and we are talking today about the Caregiver Program. My name is Karen Lenius. I'm Senior Programs Director, and I've talked about different topics over the past months. Like I said earlier, today we want to focus on caregiving. And with me, I have our Caregiver Coordinator, Amy Dahlman, who also works at Mahabi. One of the things we wanted to introduce about the concept of caregiving, we often have people ask us, well, do I qualify as a caregiver? And we typically say things like, do you take groceries to your dad? Do you drive a friend to a doctor's visit? Do you call your mom daily to remind her to take her pills? If any of those things sound familiar to you, then you truly are a caregiver. Caregiving can be rewarding, but of course also very challenging. Sometimes the tasks you do are simple and your caregiving just becomes more intense gradually over time. But sometimes caregiving is brought on suddenly because of a traumatic event, a tragedy, a health crisis, and you really don't have time to prepare for the caregiving role. The change that comes to your life, again, can be gradual or it can be very sudden. So the way you adapt to that change can be very challenging as well. Caregiving has many rewards, but it also has some shifting roles and emotions that go along with the caregiving. Sometimes you will feel troubled, you can feel frustrated, you can feel angry, and all of those things are very natural feelings. But please understand that even if it feels like you are alone, you are not alone. Because sometimes, again, when we experience some of that anger and frustration, we begin to feel guilty about the fact that we have those negative feelings. But again, that's all part of the natural process of caregiving. These are natural, they're common, and although every caregiving experience is unique because every caregiver is unique, some of those feelings can be translated from situation to situation.
And to help caregivers kind of ease some of the burden, we like to offer 2 events each year. and we call them respite days or education days. We kind of vary the themes and the topics, but we are planning our spring event, and we have it scheduled for Thursday, April 21st, and it will be held at M State this time, and it will be from 4 p.m. to 7:15 p.m. And kind of the theme that we chose this time is called Caregiver College, because we want the caregivers to come to the college and learn some valuable information that will help them. And to go with that, it's a spring onto safety and SOS. So caregivers can send out an SOS, and what that is helping them with safety. And so two of the topics, we're going to focus on kind of safety from falls, and so Essentia Therapy Department will be there to help us with some of that. And then we also are going to cover some emergency preparedness topics. So in order to be part of the day, to just get some respite time and gain some Caregiver College knowledge, you can call Mojave Ottawa, and you can talk to either Karen or myself, Amy Dahlman, and you can reach us at 218-847-1385. And I guess, do you have anything else you want to add about the day?
Well, I was just going to mention that balance is so necessary for caregivers to maintain in their lives. So please, if you feel like there's a need, if there's a service, if there's a want, please do not hesitate to reach out to us. We actually are representative of a caregiving support team that exists in Becker County, and Mojave is kind of the focal point of that team. But we have partners from various service providers who work together to provide resources to caregivers. So please reach out to us. As Amy said, call us here at Mojave. That's 218-847-1385, and we would like to help you meet your caregiving needs.
Thank you for watching Wellness for Life. Brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership, CHI St. Joseph's Health Weight Management Center, and Natural Alternatives.